Thanks everyone for joining us today. Hopefully you can see my slides. As I just mentioned, today's webinar is provided through the New England Prevention Technology Transfer Center, which is a program funded through the Federal Substance Abuse and Mental Health Services Administration. So I'm just going to give you a little info on what the New England PTTC is. We are one of 10 regional centers and 2 national focus area centers funded through the Prevention Technology Transfer Center Network to translate prevention science into trainings and technical assistance services and products to help guide the prevention workforce in adopting and implementing evidence-based programs in their communities. So we do a wide variety of programs, including, in the past, in-person events, now mostly distance learning and online trainings. We provide technical assistance and develop tools and resources. And you can find the PTTC network online if you just go to pttcnetwork.org. If you're joining us today outside New England, you can look up your regional PTTC center on this map. Lastly, from the PTTC network, I wanted to share the PTTC network uses affirming language to promote the application of evidence-based and culturally informed practices. The use of affirming language inspires hope, language matters, words have power, people first. So these are ideas that we try to incorporate into our work, and we would invite you all to do the same. Today's agenda, I've just gone through my PTTC introduction. I do have, before we get started, just a couple of brief poll questions that I'm going to set up for you all. Then we're going to move into our main presentation, which is going to be by Heidi Driscoll and Kathy Sullivan from the Rhode Island Student Assistance Services. And we'll have a little Q&A program or section after they give their presentation. And since we're all engaging in this topic together, we're going to wrap up the session with some group discussion about what other strategies and tips and challenges you all have had in trying to adapt your programs to accommodate this pandemic. So that wraps up my introduction segment. Thanks for sticking with all of that. I am now going to turn it over to our presenters, Heidi Driscoll and Kathy Sullivan, and they're going to lead us through a presentation about some of the program changes that they have made to accommodate all of the COVID-19 changes that we've gone through. So great.
Thank you so much, Kristen. Good afternoon, everybody. I'm Kathy Sullivan. I am the director of the Kent County Prevention Coalition here in sunny Rhode Island, but sunny but chilly.
And good afternoon. I am Heidi Driscoll. I am the director of the Regional Prevention Coalition for South County in Rhode Island, which is kind of our claim to fame, is kind of near the beaches down here. So Kathy and I are both part of the Rhode Island Regional Coalitions, being one in Kent, one in South County. We also want to go ahead and thank our funder, who is Rhode Island Behavioral Healthcare, Developmental Disabilities, and Hospitals. They do all of our funding.
Yep, they are our state funder. So as Heidi said, we are a regional coalition. I coordinate one region, the Kent County region in the state of Rhode Island, and Heidi coordinates the South County region, and we are 2 of 7 regions in the state of Rhode Island. And our state regionalized coalitions, community coalitions, about 5 years ago. So this is a relatively new model that we're working under, but we're delighted that we are able to do this. So we're going to talk specifically today about our work and how it changed about March 18th, like I'm sure all of your work has changed. So we're going to just share some of the things that we've done, but we're also interested in hearing from some of you about the creative ways that you've adapted, because like all of you know, we are building the airplane as we go. So some things have presented more challenges than others, and some have actually been very successful. So we'll walk through a little bit of what we've done.
Definitely. So, I mean, I think if you're a prevention specialist, you are very used to tabling events and being out in the public and being in the schools and being in your community. And all of a sudden, our lives changed. And not only our lives in personal, our work lives changed, because suddenly, you know, we couldn't do community prevention like we always have. And how were we going to go about and really invent ourselves, recreate our jobs so that we could still get to communities? And it's been a lot of brainstorming. It's been a lot of, let's try this, let's see if it works. So we're going to go through some of the things that we've done over the past 6-7 months to be able to continue community prevention.
Yeah, and as Heidi said, we are about community. And, you know, the first thing that we realized is we are community coalitions. That is about bringing our members of our community together monthly and for subcommittees to sit literally around a table together, work through our programs and policies. And suddenly we weren't able to do that. We had a regional coalition retreat planned. So that was one of the first things that we were able to work together to make it virtual, using terminology and software that is so familiar to us now, Zoom and online meetings, virtual. But at that point, Zoom was not in our wheelhouse. So we've had to learn, as you have, very quickly how to use the tools that were at hand to bring our community and our coalitions together.
So one of the first things, and probably one of the easiest, and frankly, one of the things that we were most comfortable with, was already social media. So we said, okay, people are on their phones all the time. People are home. So how are we going to get ourselves into their presence? So one of the things that we came up with was something called Chance to Chat Rhode Island. So each day, for almost 5 months, I believe, we put a slide out on our social media. And the basic premise of it was to have people be able to connect, prevention through connection. So how can we start a conversation at home? You know, it's great to say to a person like, you know, have a great conversation during your dinner, but to give them that little bit of a conversation starter. So each day we put this out. It went out on Facebook and our Instagram. And they were just great questions. We had a young lady who works with us who developed every question. So they were just meant to be thought-provoking each night.
Yeah, keep it light. Mm-hmm.
Want to take this one, Kath?
Sure. So one of the other things that we did was we have first of all, we have great staff team, but we have a lot of young people, certainly younger than Heidi and I, on this team who are much more well-versed in the creation of social media. So one of the other tools that we used was this, we had a monthly calendar. So we just created these daily small things, small activities for folks to do during the pandemic. So, you know, we were in that really early stages of the crisis where we didn't know how long this was going to take place. People were sent home, schools were out. So we wanted to just provide positives. And like Heidi said, we wanted to provide opportunities for connection between parents and their teens. So we used the hashtag prevention through connection for all of the work that we were doing to sort of archive that, or people could access it. But these were just suggestions that we were offering. Again, it wasn't an exhaustive list of things to do. It wasn't heavy, but it was just something light and different to do, hopefully off a screen, to support families in this difficult time. The lawn sign. Well, I'm going to give a shout out because I know one of our colleagues from Cranston and Coventry is here, Caitlin Bianco. But Caitlin and Dana, one of our coordinators here in Rhode Island came up with this idea. They wanted to create some messaging that was positive. They had actually looked at some of the chalk signage that kids were doing in their neighborhoods, be kind, positive messages in chalk. And they actually took that messaging and we created it into lawn signs for our communities. And you're seeing some examples here. Just positive affirmations. And for some reason, I think it just struck a nice chord. So what started out as a very small project that we were going to have these lawn signs on just municipal property, maybe at our town's town hall, police department. Members of the community wanted these. So we had to continue to make sure we got these out to as many people as possible. And I think throughout the summer, we were able to almost flood the market, as it were, with positive signage. So these are some of our municipal coordinators here with some of the signage for their communities. Law enforcement really love them. So I know in Warwick, they sponsored them for their community. So I don't know if you want to say more about that, Heidi.
No, and it's just funny when we had them printed, literally the printer said to us, this is literally the year of the lawn sign. So I'm sure in your communities, you've seen them, you're out driving. It's the easiest way to get a message across to people. And to produce a large amount isn't that expensive. They really do have a big bang for their buck.
Mm-hmm. So at a time where we weren't physically in the schools, at open houses and events, we weren't at other community events, as you know, all of our summer in-person gatherings, whether it's fairs and festivals, which we normally have a presence at, all of that was cut off at the knees. So this was at least one way to get a little positive messaging out to the community. And I think this summer was a tremendously difficult summer for a lot of other reasons as well. So I think the positive messaging helped. And we were really trying to focus on good, positive mental health for young people and their families.
So this shows you some other places, food pantries, we distributed them at, police stations, like Kathy said. Whoops.
Yep.
So then the next way that we thought, and again, we were fairly comfortable with this. We've done a newsletter on a quarterly basis. But how do we get that printed version now that we would normally do out into the public when we can't really, if you think back kind of to March, there were people who still weren't wanting to touch things, wanting to go places. So that was a real challenge for us. So we worked with a local media company who works through a newspaper, and we actually emailed our newsletter out to almost 30,000 homes. And everything was, linked. So anything you pressed on the screen, it linked directly to something else. So it was a really inventive way. And then we really wanted to come up with and be kind of the resource for starting to get some information out, not specifically about COVID, but connections during COVID. So the newsletter really had some great things about virtual field trips, things that you could do with your families. I can't think of some other things, Kathy. It was just chock full.
Yeah, and I think, and we were starting to recognize early on too that even at the height of the pandemic, when everything else was closed, the alcohol in Rhode Island, I'm not sure what other states were like, the liquor stores remained open. So libraries, schools, everything else was cut off, but the liquor stores were open. So we early on recognized that could be problematic. This was before people were even wearing masks. And so there was early information about social host laws, et cetera. So trying to stay on top of what we saw was going to be a potential problem, and it has transpired to be a problem in our communities.
Right. And we also sent this out to schools. And I think because we were one of the first to really get something out there, schools were clamoring for this. They sent it right out. It was great information for their parents. So it really helped us to become kind of an authority on connecting during this pandemic. So how do you possibly make lemonade from lemons? Because I think we all know, we're trying to find silver linings a lot of times in this work. And I think we found some. So one of the things that we really needed to make lemonade is right when the pandemic started, we were just about to do a health fair at Electric Boat, which is an enormous builder in Rhode Island of submarines. It is a huge health fair. It's a huge undertaking. It's a 2-day project. We give away 25 to 3,000 pieces of information that we package up. So we have kits, really. Men and women who work for Electric Boat come through and you just literally hand them kits of information.
And to add, in Rhode Island, we have an opiate crisis, as probably most of your states are also experiencing that. We were seeing an uptick in the opiate use before the pandemic started, and it has continued to remain at an unfortunately very high rate. So we were targeting workers in that field with opiate prevention information and information about treatment. So that was our intention with that health fair.
Exactly. So basically, just like everything else in March, it got canceled. So this is just a snippet of what Kathy's office and my office looked like after the fact. We had things everywhere that now suddenly we weren't going to be able to distribute to the workers at Electric Boat. So we really tried to come up with different ways to get things out. So these kits, just like Kathy was saying, they have alternative pain therapies, they have timer caps in them. We talk about non-opioid treatment options. We have some information in there about how to talk to youth, if you're a parent, how to talk to youth about alcohol, all sorts of great resources. So how now are we going to get that out into the public? And again, if you kind of remember, at first we brainstormed, all right, people are still going to a grocery store. We'll set something up at a grocery store. Well, that wasn't really working because a lot of really our coordinators, they weren't comfortable yet even being out in public and handing something out. So then we started to think, all right, where are people out? One of the great things was the grab and go lunch programs that were still happening in all of the school districts. So we added even more resources to these kits and were able to hand out probably 1,500 before the school year even ended. Then one of the other things that we did, and it's a tremendous resource, and almost every city or town has one, is a farmer's market. Farmers markets, at least in Rhode Island, were still going on this summer. And there's still one actually happening there's a wintertime farmers market here. Mm-hmm. And again, I laugh with Kathy and I say, if I pack one more bag, but again, people didn't want to come over to a table and rifle through things. They wanted to be able to be socially distant. They wanted to pick up information. And this allowed them to grab information, be socially distant, but yet still have things. So it really worked out very well.
And one of the things that we created, I don't know if you have a picture of it at some point, was an activity book. So what we wanted to do was create a little bit of prevention messaging for young people, for adolescents, but also some fun, there we go, some fun, creative activities for teens to do while they were home and socially isolated. So just trying to make prevention fun and accessible for them. So giving those out at the lunchtime grab and goes was a great thing. And I saw in some of the chat that was scrolling through that other people did things like drive-throughs. I saw somebody maybe from Texas just suggested that, and people did some virtual summer camps. So I know that there's been lots and lots of great creativity of ways to, for us, we're about delivering prevention messaging. This has just forced us to be creative in how we deliver that.
Definitely.
Everyone zoomed out?
Would you have ever thought, yesterday still, I did 6 Zooms during the day. Didn't know what a Zoom was, had maybe been on Skype once or twice in my life. That was about it. We made a commitment, and I really have to give this to Kathy. We literally made a commitment that first week that we would meet with our team every morning. And yes, it was for check-ins, but it was also for our mental health. And I think that was so critical. We still do them every morning. It's a great way. Number one, we check in with our team to make sure that they're doing okay. We check in with each other. And then it gives us, because we're not seeing each other on a daily basis. Those questions that you constantly have, or just needing some connection, some human connection. So this was one of our mornings. We had crazy hat day.
Sorry, Kath Gardner's on here, our Patriots fan, so sorry, Kath.
Just really, trying to lighten it up, but cannot say enough about this.
Yeah, and I would, I'm happy to admit that there were times where each one of us needed emotionally the support of each other. It's recognizing this is a difficult time for all of us, but we need to, provide self-care for ourselves and for each other so that we can be the best we can be for the coalitions that we run and the people that our communities. So, and our state has done a tremendous job. BHGDH has a campaign called It's Okay to Not Be Okay that started running before the pandemic, but it's all about reducing stigma around mental health. And I think we really had to walk that walk during this time frame to remind ourselves that it is okay to not be okay. This was uncharted territory for all of us.
Right. And move us along a little bit. So, and then, I'm sure a lot of you have done these. We really became very familiar with the online webinar. We did a screening of screenagers. We have done different things. We use a great platform that some of you might be familiar with. It's called Big Marker. It's a great platform if you don't know it. So you can have up to 500 participants. Not that we've ever had 500 participants, but so it's just a great way to get things out to parents and youth.
And I would say, to add to that, this is about attitude of we could look at the pandemic and see it as just a challenge and, we're never going to get people together in a room. But in some respects, it's been a great opportunity, because to show something like Screenagers, we could show that statewide and have 90 to 100 people attend on an evening, when if we did that in person in a high school gym, we might get 20 people. So for us, we've tried to embrace the virtual webinar aspect of our work, and we'll probably continue that long after we are able to meet in person, because it's a way if a family's busy, they're trying to get dinner on the table, if they can just grab 45 minutes of their evening to watch something, they're more likely to attend. But if they have to leave the house, get a sitter, drive 20 minutes, they might not be able to commit to attending. So try to see this time as an opportunity to learn these new skills, to reach your audience in a different way. It's called Big Marker, just for whoever, not Fig Marker. But we had to learn about
Big, B-I-G.
B-I-G, yeah.
Supporting families with fun. So, there were still at least some events that we could get out to, which was, incredible. Socially distant, wearing a mask, but doing different things. So keeping it safe. I'm going to move us along just a little bit, Kath.
Perfect. Yep. So I'm happy to talk about this. So a great colleague and a coordinator of ours, Bob Hodling, who's in the screen on the left, he was doing, prior to the pandemic, podcasting. So interviewing well-known folks in the state, coordinating interviews. And he said at the very start of the pandemic, hey, Kath, why don't we do a podcast about how the pandemic is impacting prevention work? So we started that thinking it might be a couple of weeks long. So it's now about 9 months later. Weekly, we check in with a different colleague each week and just talk about how are you doing during the pandemic? How is the pandemic affecting your work? And what are we learning from this? And I have to say, the number one thread throughout that time frame has been mental health. So we've been able to interview students, law enforcement, school resource officers, the head of BHDDH, our state department, local legislators. It's been a great, again, another opportunity rather than a challenge. So if I could recommend to you learning how to do a podcast, it's been great fun, and you can put it out on your social media channels. So not a great cost to it. And then to have youth involved in it is wonderful.
Definitely. We're down to a couple more things that we just want to go through. One of the other things we did, and I'm sure a lot of you who are prevention specialists do Red Ribbon Week. That was a huge challenge for us because normally, again, we are in the cafeterias, we're in the schools, being able to communicate with the youth. We all know how difficult it was in the fall to, the teachers could barely keep up, let alone say to a teacher, hey, can I get in your class and do something? So we came up with an idea to do a calendar contest for Red Ribbon Week. And we put it out over social media, put it to different schools about coming up. I think the prompt was something that you do to keep yourself healthy and live a healthy lifestyle. So we got great submissions, and we were able to produce a 2020-2021 calendar that is also chock full of great things for youth, again, to be doing to make a connection into their community. So each page has different ideas on it. And this calendar was really meant for kind of like that 6th to 8th grade demographic that sometimes is a little hard to reach.
Mm-hmm. So I'll talk about this. So one of the things that we were able to do, like many of you might do prior to the pandemic, we were offering what's called Hidden in Plain Sight. So it's a youth bedroom that we set up in a gym or a cafeteria, and we walk parents through the products that kids might be using in terms of substances and the ways that they might be hiding those. So I call it show and tell for parents. So it's a great learning tool that we've been very well received by parents during open houses and other activities where parents gather. Now, of course, we knew right away that we were not going to get face-to-face with parents for a long time. So what we did, and what many of our colleagues did as well, this is just one example. There's been some great examples. We filmed it and made it virtual. So what Heidi is doing right now is actually walking through this virtual Hidden in Plain Sight. So the schools loved it because they could just take the link and send that out to every family member. And then the families can walk through it at their leisure, at their time. So we just worked with a local videographer. This was his first time doing this type of project, this 360.
Sorry.
Yeah, it's probably not working, but this is, we can put it in the chat, the link to that if you want to have a look at it. And as I said, there was other great examples of this, but again, the whole idea was trying to embrace, okay, we have to do something virtually. We're trying to educate about the risks and dangers. How can we do that? So you probably can't hear it now because I can't hear it, but they're little video clips that once you click on each item, it tells you a little bit about the risks. And the whole message behind that program is to inform parents, but then encourage them to talk to their sons and daughters about what they might be seeing that their peers are using. So that's Hidden in Plain Sight.
And, let me just, whoops. I think we can stop sharing at the moment. Let's figure out how to do that. Okay. One of the things that's just amazing, and Kathy mentioned it beforehand, is, if we had done a webinar, we would have been really lucky to get 25 people in seats in a gym or in an auditorium. Same thing for an open house. We might have been lucky if we got 50 to 60 parents to go through a Hidden in Plain Sight on an open house night. We've had almost, I think 2,300 views of this. So, this is something that we will now have in our toolkits all the time. And we never would have made this without, COVID happening. So some things that we're going to continue to use. And I think they were a great asset for us.
Yeah, and I think just to wrap it up, I'm not sure what our time frame is here, but for us, some of the lessons are, words that have probably been overused during this time frame, but we just had to adapt what we were doing. We had to pivot, but we had to be flexible in what we were doing. We had to try to be positive about what we were doing. Try to make sure that people are able to connect. Now the connection is different, but it's making sure we keep young people, parents, school community, other members of the community connected in different ways. So, and also I think throughout it, what we've tried to do is have fun with it. And I think that's an important part of the work that we do, that we try to be positive and have fun with the work that we do. I am happy to take questions now, Kristen, unless you want us to break out into breakout groups. I wasn't sure how the rest of the format is going.
Yeah, let's, I know there's a couple of questions I've seen in the chat, and I know you guys have been keeping an eye and filling in some of them. I
just put in the chat also, that is the link to our website, and it gets you right to the interactive Hidden in Plain Sight.
Great.
Oh, I just put it in too, Heidi. We think alike.
So if you see a chat from Heidi or Kathy, either of those will get
Great
you
minds
there.
think alike, Kath.
Yep.
So I'm going to go through a couple of the questions that came in, and then we'll go back out for discussion. So there was a group at the beginning, you talked about your email list, and there were a few questions about, was that an email list that you already had access to, or something that you built? And if so, how did you get access to those?
It's something we really hadn't done before, but it was a service that I'm sure is offered in many states. So this particular media company works with a newspaper, and it was a paid email list. And you can really get down to the demographics of parents who have kids between such and such an age. And we got demographics on exactly who had opened the links, what links were opened, how many. And honestly, I think even if we go back to printing a hard copy, I would continue to do this because it gets into so many more hands this way.
Mm-hmm. Great.
So it's not, I'm not going to say, it's not super inexpensive, but I think it was definitely worth it for the amount of people it reached.
Mm-hmm.
Right.
Definitely. And then there was a couple questions about the teen fun book. I don't know if you can just share a little bit more about how you developed that, or kind of, yeah, what went in there and how you came up with it. And if you have a link for it that you could share, people would love that, I'm sure too.
Website, Kath?
I'm trying to look right now as we speak.
Okay.
Yeah, what I can do is I can open it. I can open it up. What I can do is I can send it to you, Kristen, if you want to share it with the group.
That would be great. Yep.
Sure. Well, this was just, an idea that we had to be able to get some type of stress relief things out to the community, out to the kids. Oh, there we go. So we've included mandalas, we've included different crossword puzzles, word searches, and I know we're going through it a little fast, but it also has a fact on each page. It has some great resources for students at the end, NIDA for teens, Above the Influence, NAMI, Mindfulness for Teens. So we really also wanted to make it so that kids then had a place that they could go if they wanted more information. And honestly, I think we will probably do a second edition maybe coming. It's very, very popular. And it was just a great, I think, thing for kids to be able to do.
Great. Awesome. Yeah.
There's a lot of different people putting a lot of work together. Our whole team came up with, and all our coordinators each had a task. One had to come up with a word search, one had to come up with crossword puzzles. So it was a great team effort.
Yeah.